Hi everybody. So today we'll be discussing about the differences between myomas and adenomyosis. So fibroids and adenomyosis are two distinct conditions in the uterus, and they need to be differentiated right from the diagnosis point of view so that because the treatments might be different as well. So myomas are benign tumors of smooth muscles of the uterus, whereas adenomyosis is tissue similar to the endometrial lining that is growing within the muscle layer. Myomas separate out the muscle fibers and form growth inside within a pseudocapsule, whereas the adenomyotic tissue actually grows infiltrating the muscle tissue. Myomas are usually well circumscribed lesions, and they have a circumferential blood supply from the outside. It's one of the ways we diagnose or distinguish them from adenomyosis or adenomyoma, which might mimic that. But when you take, it is a vague mass, it doesn't have very clear margins, and it would have blood vessels also infiltrating into the lesion, so translesional vascularity. Myomas can be formed in various locations. Adenomyosis could also be divided into the types that are focal or diffuse or different types as well, but you would not see adenomyosis in various locations. Adenomyoma in various locations. Myomas would cause pressure symptoms depending on their pressure and their site and the size. Would cause heavy menstrual bleeding, again depending especially on the ones that are more closer to the cavity, and they would sometimes be causing fertility issues or many times be asymptomatic. Whereas adenomyosis usually causes heavy menstrual period along with significant pain issues, pain symptoms, dysmenorrhea, backache, and also can cause fertility issues as earlier discussed. Treatment of a myoma would be either a myomectomy, or you could try some medical conditions. Treatment of adenomyosis, we've already discussed, is more technical. It's not that easy to excise out surgically, and we'll have to keep into considerations the fertility desire of the woman as we plan the treatment for adenomyosis. Both myoma and adenomyosis do stand a risk of recurrence, but the risk in adenomyosis would be probably higher because it's impossible to remove all of it. And secondly, the fact that adenomyosis sometimes worsens after uterine surgery would only mean that the risk is higher again after it comes back unless it's medically suppressed. So, myoma and adenomyosis are two distinct conditions that need to be differentiated in these women. Thank you.